Do you know which is the largest organ of our body? Is it our brain or is it our heart? Actually, both of them are wrong answer. The correct answer is our skin. The largest organ of our body is our skin, which almost cover 20 square feet area. Is it quite interesting, right? Just like skin, the healing process of skin is also very interesting. Today, we learn about the healing process of skin by repair process. Let's explore the healing process in our body. Our skin mainly consists of two basic layers. The epidermis, which is the superficial thin layer and mainly composed of epithelial tissue. Next, the dermis, the thick layer that is consists of connective tissue. When the skin is damaged, the type of healing process depends on the depth of the injury. An epidermal wound, such as minor abrasion or burn, which does not penetrate the dermis, here healing is a simple process in which the surrounding basal epidermal cell multiply and migrate across the wound until it is totally covered. And dermal wound involve the dermis and multiple tissue layers. Here, the healing is a very complex process. It occurs mainly in 4 steps. In repair process, incision or wound healed by a healing cascade. This cascade has 4 phases, which is clot formation, inflammation, proliferation, and maturation. The first phase is clotting phase, which is also the leakage stopping phase. Healing of a wound begins with a clot formation. To stop bleeding and to reduce infection by bacteria, virus or fungi, this clotting phase is very important. Let's see how it works. Here, the fibrin and blood platelets form a mesh, which prevent further blood loss by stop leaking the RBC from the wound area. The next phase is inflammatory phase, which is also known as calling the cleanup crew. Here, cleanup crew called to clean the wound. Do you want to know who are those cleanup crew? The cleanup crews are mainly macrophages and other phagocytic cells, which kills bacteria and clean the wound. These macrophages and other phagocytic cells are mainly WBC cells. Let's see how they work. In this stage, the damaged tissue releases histamine, which causes vasodilation, and that increases the permeability of blood vessels, which increases the supply of WBC in the wound region, and that WBC helps to remove microbes and foreign particles via phagocytosis. After this stage, 2 to 3 days later, the next phase started, which also known as proliferative phase. In this phase, mainly the rebuilding starts. In this stage, the exterior clot dries and form a scab. Then the fibroblast infiltrates the wound and secrete collagen to strengthen the clot. And this fibroblast cell again helps to migrate endothelial cells into the wound, which helps to start blood vessels to regrow. And here the immature granulation tissue containing plump active fibroblast forms. the fibroblast quickly produce abundant type 3 collagen. As granulation tissue matures, the fibroblasts produce less collagen and become more spindly in appearance and converted to strong type 1 collagen. Some fibroblasts mature into myofibroblasts, which contain same type of actin present in smooth muscle, which enables them to contract, and this helps to reduce the size of wound. The last phase is maturation phase, which is also known as reinforcement phase. Let's reinforce. This stage is occur after 3 weeks to 6 months of wound. Here, the type 3 collagen fibers are maximally converted to type 1 collagen fiber. The type 3 collagen, which was originally disorganized and are cross-linked, are aligned along the tension line when they are converted to type 1. And the unnecessary blood vessels formed in granulation tissue are also removed by apoptosis in this process. And these all collectively lead to formation of scar. And the scar is mainly formed of collagen by the process of fibrosis. Healing must happen by repair process in the case of injury to the cells that are unable to regenerate, such as neurons or nerve cells. And also in the case of damage to the collagen network or its total collapse, which mainly happen in the case of infraction. This cause healing to take place repair by repair process.